Okay. Hi, good evening, everyone. Welcome to our Workshop Wednesday. For anyone who's just joining us for the first time, our Workshop Wednesday is basically just a monthly workshop where we at PAC invite expert guest speakers to talk about issues, topics, or just share general information about certain things that can be relevant to our community and useful to our community. So tonight we are very excited to have Shalini Rajput joining us, and she's just going to be talking about certain health insurance options and open enrollment plans. Shalini currently works for a nonprofit organization known as New Jersey Citizen Action Education Fund, and she is currently certified by the state of New Jersey to help provide education on healthcare enrollment, as well as offer healthcare options for you all to enroll in. And this is especially relevant today because I feel after the pandemic, our sense of awareness for our health has been especially heightened. And although it's important to consistently visit your doctor for checkups, this can become hard because of financial issues or certain medical conditions that require frequent doctor visits. So it's always important to know our options in regards to healthcare and just be guided to finding the right plan for us. So with that, I'd like to pass this presentation over to Shalini. And I'd just like to ask all viewers to save their questions until the end. If you don't want to memorize your question, just feel free to put it in the comment section. And during our Q&A at the end, I will ask Shalini. So whenever you're ready, Shalini, take the floor.
Thank you very much, Fahad. Thank you for that lovely introduction. Good evening, everyone. My name is Shalini. I am a certified assister with New Jersey Citizen Action Education Fund. That's a nonprofit organization, and I am certified to get enrollment on healthcare via Get Covered New Jersey. Without delay, now I will start sharing my screen and providing the information that we need. Once again, thank you for joining me today. And like Fahad said, if you have any questions, we will have option at the end to answer those questions. I'm just going to share my screen very quickly. Fahad, let me know if you can see my screen once I do it. No, you don't. Can you see my screen?
Yes, I can.
Perfect. So today we are talking about ACA special enrollment. ACA stands for Affordable Care Act. So we are talking about special enrollment for healthcare. Why we are talking about a special enrollment is because open enrollment just ended January 31st. So now we are in a period which is called special enrollment, and we'll discuss more about it. So I don't want to just talk all the time and then take away everything. Before I go ahead, I just want to let you know that the information I'm sharing today is the work that we have researched based on the information that we could. State or federal government does not, it doesn't reflect their views as such, but it is best to the accuracy of our knowledge. Before I go ahead, just to provide you a little bit information about who is Citizen Action. We're a nonprofit organization and we fight for economic and social justice. We provide many free services like healthcare enrollment, which we are talking about today, tax preparation, financial coaching, first time home buyer counseling. We recently started eviction protection services also. Um, I could not list everything over here, so I sincerely urge everyone here to go on njcaef.org website and explore the options. The services that we provide are absolutely free of charge. We are providing a lot of education and advocacy. We're trying to help as much as we can, and please take benefit of them. So please go online and check it out. Follow us on Twitter and Facebook as well. Now, coming back to our topic for today, Affordable Care Act or ACA. What is ACA stands for? ACA is healthcare enrollment, which provides affordable coverage, like it says, like the name suggests, it provides affordable coverage. Now, it provides, apart from that, many benefit that usually we don't get outside. Like it covers people with existing pre-health condition, uh, no questions asked, no difference in terms of who, if anybody has pre-existing or if anybody does not have pre-existing condition. It doesn't cost anything more. Preventive care is absolutely free of cost in any of the plans for Affordable Care Act. It gives more coverage options for young adults. There is no lifetime yearly dollar limit. That means if anybody enrolls in any of the plan on health on Affordable Care Act, uh, insurance cannot come back to you and say that we have spent certain amount on you and then this is it. We do not cover you. It doesn't happen like that. They would cover you for the entire time period of coverage for you. It does hold insurance companies accountable if they increase rate. That means they cannot increase the rates during the enrollment period of you. If you have enrolled a certain time and then until the end of the enrollment, there would be no change in rates for you. Even if even if you get diagnosed with anything later on, or if for any reason, insurance companies cannot cancel your health coverage just because now that you actually need it. They cannot cancel it. Best part is that it does provide the choice of the doctors. So I have been enrolling people since it started, and 95% of times, if you have a doctor that you're already consulting, you do get option of getting that doctor in one of the other coverage, and it's very helpful. Then when you do not want, I mean, I do not want to change my doctors very often when I change my coverages. So I want to make sure that they are in plan, and 95% of time, like I said, they do one of the other plan do take the same doctor. And it does provide protection from employer retaliation. Before you get more information about healthcare, you need to understand why is it important, what do I need, and how do I use it. So why do I say it? You'll say, we are here to know about healthcare enrollment. So why are you saying it? I'm saying it because you need to understand that why this healthcare insurance is important for me. As in, do I need it because I just want to make sure that I go for my preventive checkups often, I have everyone in my family insured, or do you need it because there is some existing condition and you want that to be taken care of? It doesn't matter, but it gives you more clarity when you choose your options and when you go ahead and actually get any coverage. This is why I said, why is it important and why do I need? Of course, everybody needs insurance because you need to take care of your health. What is my need? So, what is your need? Do you have anything, any major medical requirement coming up soon? Or do you just need it just to make sure that everything happens, everything is good, and if I need it, I have something, I have a coverage in place for me? What are my choices? This is a very good question, that what kind of choices do I get? Do I need high deductible plan? Do I need low co-payment plan? Do I need something that just takes care of for my everything and my basic, my routine checkups? How, this is most important part, how much will it cost? In terms of, you cannot immediately predict how much will it cost, but then you would need to make a budget to see that if you need to spend something, or how much can you spend from your monthly expenses. So I usually say this, that keep your monthly expenses aside and then see that how much can you afford towards your healthcare. Why I say this will help you in case you need to incur any payment. You would it will help you to decide that how, which plan do I go for. This makes it very easy, and I've been doing this for such a long time, like I said, and it helps a lot when it comes to the decision. Why is having healthcare insurance important? This is very hold on, this is very basic question, and I'm asking this will be like, Shalini, why are you asking this? But it helps. Everybody can have emergency. I am walking and there is snow outside my house. So I am walking, I can slip and I can just break a bone. If I just go to emergency room like that, it's going to put a big dent in my pocket. If I have health insurance. On the other side, I may have it completely covered, or I will just pay a portion of it. That's it. Even if nothing happens, if you just see the doctors on just a regular basis, just for preventive checkups or just like cold, cough, or fever, it keeps on adding on, especially when there are more in the family. So that way, having healthcare insurance helps you take care of your pocket. Preventive services itself sometimes can become costly, and it is very important to have those preventive services done to make sure that everything is with our body is in check, and everything is going on absolutely fine. There is no hidden surprises waiting for us within our own body. So these are very important, and even if we go just for preventive services without insurance, it can be more costly than having the coverage. So in my opinion, one should have some of the other coverage. If you do not have it from job, this is an option for you, and I strongly suggest everyone to check this out. Even if they're not taking the coverage, at least check it out and put the application through. You will be surprised, and I tell you, you will be surprised how much you can get. So coming back to our topic of special enrollment, it was just my pep talk to make sure that you know that healthcare is important. The special enrollment period started from February 1st. It will be until October 31st, 2022. What does it mean? It means that if you miss the boat of open enrollment and now you have a life event that qualifies you to get a coverage, you can get that health coverage in this period. What events that could be, and this is just an example. You could have an event that is not listed here, does not mean that you will not try to get that coverage. Try, please, at least try. Some of the events could be like you lost the job, or it's not even lost the job. If somebody have a change in job also, let's say somebody was working full time before and now they are part time, their coverage from the job has changed, or the coverage from job is no more because their job type has changed. That can be a life event. There is a change in income. Somebody was earning more before, now they're earning less, or somebody was earning less before, now they're earning more, or because of the change in income their Medicaid coverage stopped. That is also one more life event. Change in immigration status or citizenship. They did not have the immigration status before, now they do. Or if they did not have a green card before, now they do. If they did not have the citizenship before, now they do. Death of a family member or a spouse. Somebody just got married or got divorced. So any kind of change in family status. There is a new child in the family by birth or adoption. Somebody just moved to New Jersey because this coverage is for New Jersey. Somebody moving to New Jersey does qualify as a life event. Or simply if you're no longer qualified for NG family care because you're earning more, or there is a change in family member status. Now they're not qualified for NG family care. Or you had put your application sometime in early January, and now NG Family Care is coming back to you saying that you're not qualified for NG Family Care, you will still qualify for this life event. Latest as of last year is pregnancy. Earlier, anybody who got pregnant after the open enrollment ended, or during a period of February to October, they were directly being referred to Medicaid. Now, if you are pregnant or if you get pregnant and you do not have coverage, you can apply for the open enroll for the ACA anytime. You would ask me who would be eligible. Anybody who is a resident of New Jersey and does not have a coverage does fall under the special event category. Again, if anybody is a dependent of somebody who is residing in New Jersey. Let me explain you a bit more on that. So let's say the earning person of the family or the head of the household is having coverage from their job, but their job is not covering their dependents, and now the dependents are under the special event. Let's say they just came to New Jersey, or their status just changed, or their income just changed. So in that case, they would be eligible for a special enrollment. Any citizen or non-citizen who is lawfully present. Why I say this is because for ACA purposes, anybody who has even the employment authorization, it doesn't have to be citizen itself, it doesn't have to be a green card for 5 years, and that doesn't apply for ACA. So if you have a, even if a EAD, or if you have any other status in terms of immigration, you can qualify. So please try to put your application through and see what you're qualified for. Or if you're not just if your current plan is not considered affordable under health insurance, you can qualify, depend given that you have that special event in life. So the next question comes is, now when I enroll, when would my coverage start? If you enroll by end of February 20th, your coverage will be effective from March 1st. If you enroll by March 31st, you from like if you enroll from March 1st to March 31st, anytime, your coverage will be effective as of April 1st. Same thing if you enroll by April 30th, your coverage will start from May 1st, and if you enroll by May 30th, your coverage will start from June 1st, so on and so forth. And special open enrollment, like I said, just ended. It was open from November 1st to January 31st. It just ended that, and now we are in the phase of special enrollment. One thing most important about special enrollment is that you would want to make sure that you are within the timeline of reporting that event. It should be within 60 days of the event happening. If you lost a job, if you're new to New Jersey, any of those events I listed, to be better sure, I would say please report, or please act, or to get your insurance as soon as possible. Do not wait for those even 60 days. Do not wait for that timeline. Just try to act on it as soon as possible. Something like pregnancy or income change can be retroactive depending on the type of event that you have. While working on Get Covered, you will hear this word a lot: advance premium tax credit. It is a tax credit given to you in advance to lower your monthly premium. So once you get your enrollment done, you will see what you're qualified for. They will say you are qualified for this much of advance premium tax credit. That means this amount is being paid directly to your provider towards your premium, which lowers your premium in turn. One thing most important is to be honest, very, very honest about the income that you're receiving in the year that you're enrolling for. This one should be 2022. Your tax credit is based on the income you earn for the year that you're enrolling for. So when you're enrolling, you will estimate your income for 2022, and then you will go and take it from there. It is an estimate, so if it changes, sometimes you are able to update that later on in your profile. But try to be as much accurate as possible and be honest about it. If you predict a lower income, you may owe money to marketplace later on. Or if you predict a higher income, you may receive some premium tax credit back when you're filing your taxes. You do not have to accept all of APTC. If you do not want to, you can choose a portion of it. There is an option, and if you need help, you can always ask for help, and we can provide you help with that. It's very important when you're filing your taxes, if you received any kind of APTC during the previous year. So we are in 2022. If you received any kind, if you were enrolled in the marketplace last year and you received any kind of APTC, advanced premium tax credit, it is important and very much important to disclose that amount on your taxes. And if there in, like I said, if there is any change in income or household size, it is very important to report that in time to avoid any penalty when you are filing your taxes. What are the options for people in New Jersey? One is NG Family Care or Medicaid. Most of us are aware of it. NG Family Care or Medicaid is provided by a state. It is a free or low cost insurance for, it covers children up to age of 19, adult from 19 to 64, or uh, people who have disability or age-based disability. It is based on income and household size. So once you put in the application, it is evaluated in terms of whether or not you're qualified for NG Family Care. And this is very important. Once you put in the application for Marketplace on Get Covered in New Jersey, your application goes towards both the places depending on what you're qualified for. If if you're deemed qualified for NG Family Care, the application goes towards NG Family Care for further evaluation, and then they either approve you or ask you for more information, or they can say that you're not eligible for NG Family Care as this point. If you are not deemed eligible for NG Family Care, your other option is Get Covered New Jersey, which is the marketplace for state of New Jersey. So everybody who had coverage from ACA before from healthcare.gov did migrate to Get Covered NJ in 2021. So every New Jersey resident who does not have a coverage from anywhere else can get option of healthcare insurance from Get Covered New Jersey, which is the marketplace. So I was telling you that if you do not get qualified, or if you get denied from NJ Family Care, you can still get coverage from marketplace or Get Covered. You just have to let them know that you have been denied, or if you had put your application through Get Covered NG itself, that information automatically gets informed towards your application, and then you can go ahead and get the coverage from Get Covered. Get Covered is one-stop shop, like I informed you. Once you put in the application, it goes automatically towards NG Family Care if it needs to. If not, then you will have an option of getting coverage from Get Covered. You do receive, you can receive financial subsidies to pay health pay premium. The subsidies is in terms of APTC, and of course, state of New Jersey also puts in some amount towards the subsidy additionally. There is no extra cost to have an assisters, or assisters like me are there. We are trained by state, we are certified, and we are able to assist as much as possible. We are able to provide you the information on the application. We can process the application for you. We can, if there's any document required, we can upload that for you. We can try to find answers for you. Sometimes we do have an answers for you. Sometimes if we do not, we try to get them to you. The application is also online. If you go on getcovered.getcovered.nj, you can find the application. It's pretty easy to fill in, but sometimes there are some questions when we think, oh, I don't know how do I answer this one, or should I answer it like that. Quickly, you can get an assister to help you out. Literally every page have an option to find an assister. You can just take an assister's help and then take it from there. Like I said, there's no extra cost to have an assister, so do make use of that benefit. There are four major providers: Horizon, AmeriHealth, Oscar, and WellCare. Latest this year, I cannot stress enough, the coverage is awesome. Like I said, 95% of the healthcare providers are under the plan. So 95% of time when I go and choose, somebody says I have this doctor, do they take my plan? Most of the times it does. Like I said, we are certified assisters, we are trained and certified. There's no biased assistance. We work for you, we work in your interest and your benefit. So we can upload the documents for you. We can try to assist you as much as we can. We can also submit your application for NJ Family Care, and of course, it's free of charge. We do speak English, Spanish, and Hindi. And if this is not one of the language that you want to speak, marketplace have option of choosing the assistant of your language, so you can choose from there as well. So these are few terms that you would come across when you are putting your application through, or when you're choosing your plans. Premium would be an amount that you would pay monthly, just like a monthly premium we pay towards our car insurance. It is a certain amount that you would pay uh, in some cases if you need to. Deductible would be the amount that one must pay before the health plan begins to pay for the services that has deductible applied to them. Preventive care, like I said, is absolutely 100% covered in any of the plan for marketplace. Co-payment is a set fee that we pay every time you see a doctor. It could be, and usually it's listed on your insurance card. So it would say for the primary care doctor you have to pay this much, like $10, $15 something, and for a specialist you need to pay this much, could be like 20, 25 or something, depending on what kind of coverage you have and depending on what kind of coverage you qualified for. Co-insurance is nothing but a percentage that we pay after the deductible is completed, and the amount for the services that we use. We usually hear like this coverage is 80% and 80-20% or 90-10. So 20% or 10% is what your co-insurance would be if it needs to be from the coverage. You would often hear the word in network and out of network. In network is nothing but the provider or the offices that are in contract with your insurance provider. Out of network is the doctor's office that are not in a contract with the provider. Some plans do need a referral. That means if you have to go to see a specialist, you will first need a referral from your primary care doctor, and then you can go and see it. It's up to you. If you do not want to choose a plan that does need referral, you can tell your assistant, or you can choose a plan that does not need referral. We just put through this plan summary. So this is somebody's actual plan that we have worked through. I actually processed this coverage. So their coverage did start from January 1st, and they will have coverage for the whole year. It's just saying pending because the time that this snapshot was taken, the insurance was still reviewing the coverage. It is now confirmed, I'm sure. Their monthly premium was supposed to be 563, supposed to be. The APTC amount that we discussed before, the premium tax rate given in advance, they got was 562. They also got some help from state of New Jersey. This is showing $1 only because if you see the difference from premium and APTC is only $1, I'm sure they got much more amount. They got qualified for higher amount. How much premium they are paying? $0. They're not paying any amount for the whole year towards their coverage as premium. They may have to pay some copay when they see the doctor, but not any premium at all. The effective date is starting January 1st. Now that we know that we need insurance, so we got onto a laptop, we got our insurance done, we got the coverage, we got the card. It's time to call your doctor's office. How would you choose a doctor? I said the word in network last time on the last sign. It's very important because let's say you have a neighbor who has seen a doctor, and the doctor say, oh, this doctor is very nice and you must go and see them, and they took care of me, everything very perfectly, and everything is nice. I'm sorry, everything is now nice, and you must go to this doctor. You want to make a phone call and make that appointment. Wait a minute. Make sure that doctor is in network for your coverage. Why I say that? Because you will get best of your benefit when you go to any provider who is in network. And like I said, the coverage is huge, so I'm sure you will get some or the other. Most likely, you'll get that doctor as well. But you want to make sure to avoid any surprises at the last minute. How will you ensure that this doctor is in coverage? You can call the health insurance company that has your coverage, tell them the name of the provider, and they can tell you whether or not they are in network. Or you can check the health insurance website, or you can call the doctor itself who you want to make the appointment and tell them that this is my coverage. Do you take, are you in network or not for them? Or do you take this plan? If they do, great. Make that appointment and go for it. Primary care doctor is called PCP. Again, specialist is the doctor who would be somebody like a cardiologist or neurologist or any specialist. Please remember before I close that you need to maintain your health by getting it covered. Please visit your primary doctor for non-emergency things. This will help you and your pocket not to get any additional cost which you are not required for. Go to emergency rooms only for emergencies and visit a doctor for everything else. And please be honest about your income information when you're putting the application. This is our information. We are able to provide help by phone, by web conference, and in person now. We are able to provide in person help. Our office is in Elizabeth. This is the address, and I will send this slide to PACC, PAACC, I'm sorry, PACC, and then you can, and they can share with everybody or anybody who needs this information. Fahad can share with you. Uh, and this is my direct information if you need to get in touch with me and have any questions or need any help for enrollment or just need to put in your application. I will also share my information with Fahad and she can share with you. In the beginning, I gave you all information about the services that our organization does. This is the contact information if anybody is interested. Again, I will share this slide with Fahad and she can share with you all later on. And I'm up for questions.
Awesome. Thank you so much, Shalini. I'm sure I'm not the only one that benefited from that presentation, so I really appreciate you taking the time to do this for us. We actually currently don't have any live viewers, so I think we're good on questions. We are going to be uploading this to our Facebook and YouTube pages, and I will, if you don't mind emailing me the presentation slide, so that if people need it for resource, then please, that would be great. We'll share it with our community.
I will definitely email you all those contact information so that you can share with, and even you can share with anybody else who you think that you can, they can benefit.
Yes, thank you. I appreciate it. With that, I think that concludes our workshop. So if you want to come back in a month or two, feel free to. We would love to have you. And thank you again for your time.
Absolutely. And would you be able to share this recording link with me once you are done, like editing and everything?
I'll share the YouTube and the Facebook. Definitely with you.
Perfect. Thank you so much. Thank you. Have a good night. Good night, everyone.
Bye. Good night, everyone.